everybody. It's Ryan here, your physician friend. Hope you and your family are doing good. A warm welcome to this. It's our 110th episode in Practical Internal Medicine, and today we're talking about mouth disorders. If you haven't yet subscribed to my channel, I hope that you will consider that. Okay, quote for the day, everybody. When everything feels like an uphill struggle, just think of the view from the top. True story. And that joke. Wondered what languages do oranges speak? Well, it's Mandarin. Okay, guys, today we're talking about mouth disorders. Okay, so when it comes to this, I mean, there's lots of issues which can affect the mouth. As we know, this could be a manifestation of a systemic disease. All right. So we can broadly partition this into issues affecting the teeth versus the mucosa. And the mucosa, is it ulcerating or non-ulcerating? That's the basic foundation of the way to think through it. So the teeth, as we know, with gastroesophageal reflux disease, is some people describe a sensation of water breath, like a bitterness that comes up at the back of the pharynx. And if a patient has GERD, then we know acid is toxic and can actually damage the enamel, so that can be a manifestation. Sjogren's syndrome, remember they have xerostomia and xerophthalmia, etc. So diminished secretion from exocrine glands. And if you don't have enough saliva production, and that then predisposed to dental caries, okay, not Mariah Carey, dental caries. Okay, mucosa ulcerative versus non-ulcerating lesions. If it's ulcerating, you could ask yourself, is it GI or other? GI, we know, ulcerating mucosal lesions which can manifest in the mouth. Crohn's disease, and Crohn's disease illustrates skip lesions, okay? It can occur anywhere from the mouth to the anus. Ulcerative colitis, probably not that common. Non-steroidals, you know that non-steroidals actually predispose to ulcer formation because they inhibit prostaglandins, and prostaglandins actually promote a variety of protective functions in the body, one of them being the buffering layer of the mucosa, right? It causes mucus production and increases your bicarb concentration there. So prostaglandins are actually protective for your mucosa. So if you give non-steroidals, you inhibit that, okay? And that predisposes to ulcer formation. Other issues, things like cold sores, anemia, Langerhans histiocytosis, Wegener's, which is now called granulomatous polyangiitis, sarcoidosis, and there's numerous manifestations of sarcoidosis. We know it causes skin issues like lupus pernio, erythema nodosum. It causes arthritis and dysphalangeal bony cysts. It causes reticular endothelial enlargement, hypercalcemia, ophthalmic issues with anterior uveitis. It causes aseptic meningitis and that, right? It could be drug induced or STI. But if looking at the mucosa in terms of a non-ulcerating lesion, then we divide it into whether it's lighter, darker, or if there's no color change. So what's the color change? If it's lighter, we're thinking, okay, is it non-neoplastic versus neoplastic? The non-neoplastic candidiasis, oh man, RVD positive or immunosuppressed, coming in with a whitish lesion in the mouth, you know the most likely that's going to be candidiasis. But the big differential for that, everybody, is oral hairy leukoplakia. Oral hairy leukoplakia. Now, how do you tell the difference? Well, candidiasis is caused by Candida albicans. It's a fungal infection, whereas oral hairy leukoplakia has an association etiologically with Epstein-Barr virus, EBV. And where on the tongue does it occur? So candidiasis is no respecter. It can occur anywhere on the buccal mucosa, on the tongue, but leukoplakia likes to sit on the lateral aspect of the tongue. And the other differentiating factor, if you try to scrape off this whitish plug, Candida will come out with some bleeding if you use like a wooden spatula, but leukoplakia will not come out. Okay. Other issues, lichen planus, it could be anemia, so just a pale tongue. Squamous cell carcinoma is the other differential of a neoplastic, lighter, kind of non-ulcerating mucosal lesion. If it's darker being red, okay, then we're thinking about gingivitis, which is basically inflammation, infection in the gums. Disease. Okay. So you're thinking about a strawberry tongue is the manifestation. Remember, guys, Kawasaki is a medium sized vasculitis, has a predilection for affecting the pediatric population. So we don't see Kawasaki that often. Probably more common amongst the adult population in terms of causing a medium-sized vasculitis would be our good friend polyarteritis nodosa. And polyarteritis nodosa classically is involved with which infection? I can't hear you. Hepatitis B, very good. Okay, other gum disease, mucocele could be an allergy. If there's no color change, and it's a non-ulcerating mucosal lesion. Think about chronic liver disease. But remember, other accompanying stigmata of chronic liver disease will be your jaundice, will be your axillary alopecia, will be your spider angiomata, maybe stigmata of portal hypertension, maybe other issues, right? And etiologically, you have risk factors for cirrhosis. Sjogren's syndrome can be a standalone thing, or it can be in the context of other autoimmune disorders. We get xerostomia, xerophthalmia, and that. Acromegaly, you guys know the issues there. Amyloidosis, psoriasis, gingival hyperplasia, dry mouth. Now, the one that's not really mentioned here is scurvy. The scurvy causes classically perifollicular hemorrhages, but can predispose to obviously dental caries and bleeding gums. Right? I'm sure you guys have watched Pirates of the Caribbean, and the way those pirates' teeth look, they have very bad dentition because they don't have vitamin C because they are out at sea. I'm not vitamin C, I'm C as in the ocean. Okay, quick fire again, guys. Mouth disorders, which are oral manifestations of systemic disease, can involve the teeth or the mucosa. If you're looking at the mucosa, is it ulcerating, non ulcerating? If it's ulcerating, is it GI or others? And if it's non ulcerating, depending on the color, is it whiter, is it darker, or is there no color change? If it's lighter, is it non neoplastic or neoplastic? Okay. All right, my friends. Now, you know that the Lord has given us His word. I want to make an analogy. Imagine if you were to buy a very, very expensive tech equipment, like an expensive camera. Would you want to care to read the manufacturer's instructions before you use the item? In so doing, you'll prevent misuse of the item so it wouldn't break. You can maximize the function of that particular item. God has given us a blueprint for life. It's called the Holy Bible. And in that, we will discover what's God's purpose and plan for our lives. But if we want to live our lives without considering God's Bible, God's instruction manual, then the likelihood is that we may damage our lives. We won't live to our full potential. We will not accomplish God's purpose and plan for us. So let us return to God's original plan. God says in His Word, that his word is a lamp unto our feet and a light unto our path. It illuminates the way forward for us. And fast forward to the New Testament, it tells us that um, in Jesus was life, and that life was the light of men. It tells us that Jesus was the word made flesh. Okay, so if ever you're confused about your purpose for living and your purpose for life, let's get back to God's original blueprint in his word, seen in the life of Jesus. Amen. You have yourself a lovely day. God bless you. Here are my references. Take care.